Your understanding of the type of surgery and the recovery process to follow could make or break your outcomes. So in this video, I will review 4 crucial questions to ask your surgeon before undergoing surgery. Hey everybody, welcome back for another episode of Physio Show. The very first question that you should ask your surgeon is this surgery actually necessary? While this may sound like a very obvious question, it deserves to be asked, because there are numerous common surgical procedures currently in practice that have no evidence to support their use. A good example of this is arthroscopic surgery of the knee, which is one of the most frequently performed orthopedic surgeries. However, there are loads of evidence that suggests that it offers no discernible advantages to non-surgical management. This is why it's important to do your research or talk to someone who is up to date with current evidence, because changes in medical practice patterns often lag behind research a good 15 to 20 years. So this means if your surgeon is 50 years old, they are likely still practicing the way they were taught during residency, which may not reflect current evidence. The second question that should follow is, what's the likelihood of success? All surgeries are not created equal. For example, total hip replacement surgery has been shown to generally have excellent outcomes, while those who undergo rotator cuff repair tend to have more varied results. This variance in outcomes can be attributed to the complexity of the shoulder joint, the diverse types of rotator cuff injuries, and the intricacies of the repair process. So as you can see, successful surgical outcomes is influenced by a number of factors, including the nature of the procedure, the specific characteristics of the patient, and the dedication to the recovery process. And discussing these aspects with the surgeon is critical to making well-informed decisions and to setting realistic expectations when considering surgery. Think of it like this. Your surgeon's confidence that the surgery will lead to notable improvements in either pain and/or function should be high. If it's not, it's probably best to hold off. Once you get a good sense of the likelihood of success for the specific procedure, the third question should be, what will it take to recover? As we mentioned, commitment to the rehab process could make or break your recovery. Because even within the same surgical procedure, outcomes can vary drastically from one person to another. Those who are committed to the rehabilitation process and follow post-operative instructions are more likely to achieve favorable outcomes compared to those who are less engaged in their recovery. So if you're planning on having a surgery with a tough recovery but don't have the motivation to participate in the rehab process, you probably shouldn't have the surgery then. The most reliable source of information regarding the recovery journey is your physical therapist. They possess the expertise and experience to provide you with comprehensive insights into the rehabilitation process, including the timelines, specific exercises, and precise steps you need to take for successful recovery. If you're finding value in this video, give it a like and subscribe to the channel. Your support goes a long way toward helping us grow and continue providing answers to all your rehab-related questions. This brings me to the fourth crucial question. Are there alternative treatment options available? In the vast majority of cases, the answer is a resounding yes. Surgery is rarely the initial or preferred course of action. Unless there is a health concern or a clear-cut traumatic injury that absolutely needs to be managed surgically, there are a bunch of other safer treatments that should be considered. This is especially true in cases of chronic pain where there is no trauma to speak of. Physical therapy should always be the first option when it comes to non-surgical management, paired with pain management strategies such as medications and injections, as well as education on activity modification. You would be surprised about how much improvement you can make with the right guidance. So don't rush into surgery without considering the associated risks, the likelihood of successful outcome, and the comprehensive recovery process that follows. In most cases, there is no harm in taking the time to explore other treatment avenues first. By exhausting these alternatives, you can make a more informed decision. If after all that, you still are dealing with significant pain or functional limitations, and the potential for success through surgical management justifies the associated risks, then it becomes a well-considered choice. This ensures that you go into surgery with confidence of having made the best decision for your unique circumstances. Well, I hope you enjoyed this episode of Physio Show. Stay tuned for the next episode to learn more about your body, how it works, and what it needs to keep moving.